Just as talk of COVID seemed to be simmering down, the Omicron variant made its appearance, and the arrival of this new variant has turned any good news about the pandemic upside down. But there is one good piece of COVID news that came out of today, and that is that a new COVID-19 treatment has been approved, and it's all in the form of a pill called Paxlovid. Our Nixon Norman has more.
As the Omicron variant is quickly becoming the dominant variant, there has also been an increase in hospitalizations again.
I think it's important to mention that the number of pediatric patients that are now admitted is 3 times what it was just a month ago.
There are many fingers pointing as to what could be behind this particular increase.
Is it the Omicron variant? And the answer is it is highly likely that it is. And the second question that we ought to be asking is it also having contribution from football and other fall sports and gatherings and holidays? And the answer there is also it's highly likely that it is related.
The variant that came on the scene before Omicron was the Delta variant, and the two are oftentimes compared to each other.
The thing about Omicron that is more concerning is that it is much more transmissible than the Delta variant.
But they also share a few differences. One of them seems to be severity.
How it's a little bit different, I'm hoping that this early evidence will continue and be the real evidence long term, is that it is perhaps less severe.
Because of this increase in transmissibility, healthcare professionals are saying it's a good idea to have an at-home COVID test on hand and to use it if you plan on gathering during the holidays.
So if you have access to at-home testing, it may be a good idea to do that prior to gatherings in case you are minimally symptomatic but infected.
On the other hand, for many, there is good COVID news. A new treatment has recently been approved. This treatment comes in the form of a pill made by Pfizer and is called Paxlovid.
Well, obviously, if you have an oral treatment for a serious illness like this, it can be much more available. Right now, the monoclonal antibodies require that you go to an infusion center, someplace where they have the capability, and then the observation for, and most of the time it's an hour.
But there are no current predictions on when people will be able to get their hands on them. So in the meantime, Hudson says it's best to get vaccinated. Nixon Norman, Fox 54 News.